Obviously, SIX will still exist as an annual conference organizer, and it will stay in Italy. But for those of you who have followed our society since its beginning, know that the name means Italian Society STEM, Cell and Ocular Surface. So as I said at the beginning of this conference, the acronym is going to stay, but with a different meaning, because we have added the International Society, and we have with us these distinguished and great surgeons and friends who've been accompanying us for years. But now we have a very specific approach and purpose, that is to say, to act in favor of developing countries. And developing here doesn't mean economically developing, but it means countries that have been developing corneal surgery in the last 15 years. So it will be Corneal Foundation for Developing Countries. So Corneal Transplant Foundation for Developing Countries, the new name in a sense, or the new mission. Because if we consider blindness around the world, we realize that corneal blindness comes number 4 amongst all the causes for loss of vision. And in epidemiology, you may see that trachoma is still a disease affecting and plaguing our patients, but we have also many ocular trauma and corneal ulcerations, and especially children diseases. And even more important, this image has been published 6 years ago, where you may see that in blue, the nations having a sufficient amount or production of tissues, that they can even export tissues around the world, is shown. And we are very proud of what we have been doing in the last decade, because Italy has tissues covering the Italian requirement, and Italy exports tissues abroad into the States, and with a very small country we used to call Ceylon in the past, now it's called Sri Lanka. In this country, there is a very good system for recruiting corneal tissues, and Sri Lanka as well exports tissues. So around the world, about 184,000 transplants a year are performed. But these tissues are usually supplied by 86 countries only. So the countries performing more transplants in relation to their number of inhabitants is Canada and Lebanon. So, Samir, congratulations. But only the United States, Sri Lanka, and Italy do export tissues. So we take a look at the most important or the main indications for transplants, we see that Fuchs dystrophy actually represents one, or certainly the most common cause for transplant. And so we're looking forward to the medal lecture by Dr. Colby. And keratoconus, of course, occupies nearly 30% of all indications to transplant. And we know that most of these keratoconus can be resolved with a DALC, and also Fuchs dystrophy, if treated early enough, can be resolved with a DMEC. And here again, we see that top indications for a DALC and a PK aren't that clear-cut any longer. In many cases, DALC can be performed. What I mean is that lamellar surgery is a source, a way to spare and save a lot of tissues, and this can allow us to resolve a lot of issues. I'm talking about both DALC and DMEC, because a center where very good DMEC and DALC procedures are performed, and this allows to use a single tissue to do at the same time a DMEC as well as a DALC. And this is extremely important, because if we take a look at the survival rates after DOLC in the long term, and this is the Kaplan-Meier measurement are higher than with the penetrating, but also DMEC showed to have a long-term endothelial survival that is superior to other techniques, DSEC as well as PK. So what I mean by this? I mean that about 53% of the world population has no access to corneal transplantation. Only one cornea is available according to the paper we shown before, but whereas 70 would be needed. This means that the world requirement of tissues has increased by 70 times, or at least that the supply of tissues should be increased by 70 times. So all efforts to encourage corneal donation should be favored as much and encouraged as much as possible, but it is essential to develop alternative solutions such as corneal bioengineering. But let me add one more option, which is to use lamellar tissue over the world and increase the number of lamellar transplants, and therefore to share the same tissue for two recipients. And this might allow us to reduce enormously this requirement by 70 times and maybe bring it down to 40 times the current supply. And I have now considered my outcomes because it became easier for me. So in our hands, PK actually has reduced to 2%, and DMEC 58%, DSEC 11%, DALK 29%. But I think the same is true in many modern corneal surgery center using lamellar keratoplasty techniques. But if we take a look at the numbers and the statistics by the Eye Bank Association of America, we see that out of 11 international eye banks, donations are 135,000, but the results have been really outstanding because 84,000 used in the States, the rest is being exported. But if we take a look at the number of surgeries performed, and I here tie in to what I said before, that we have to continue our efforts in terms of DARC, you see that the PK is still performed in about 19,000 eyes per year, whereas the endothelial keratoplasty is very present and is becoming more and more common, nearly 30,000, 70,000 of which DMEC, whereas DARC is only amounts only to 1,000 procedures. And this isn't really up to what surgery today can give us. So PK goes down, as you may see in this diagram, in this case Sirius, compared to the EK, which is on the growth, on the rise, and DMEC are growing in the States, whereas DALK is not growing. This means that there isn't a school that has, or a school of thought, I would say, that has really become widely shared in the States. But in Italy, where the lamellar keratoplasty certainly has really been widespread, we have a lot of centers performing it. But in Italy, in 2015, it was all about 2,700 PKs were performed still. So in a nutshell, the corneal blindness is still today the fourth cause for blindness globally. It seems that the pool of donor corneas has to be increased by at least 70 times. There are countries which are exporting. So if we improve the recruitment system for tissues. There is no reason in the world for which cornea blindness cannot be defeated. And if we increase the use of lamellar transplants by reducing the need for tissues, probably even lamellar transplants will grow, and and I hope the problem may be addressed and possibly abolished or resolved in the future. What can SIX do? We have already organized as many as 17 meetings since 2001. We are very proud in saying that we have introduced in Italy AM, CLAU, transplants from living donor, and we've also strengthened and enhanced the use of the big bubble that was born elsewhere, but in Italy has developed a lot, and also DSEC, and we have here Dr. Mark Terry, who for the first time in Italy performed a vitreous transplant in 2005 in a SIXO meeting, and we were the first to perform a K-Pro thanks to Sadir Anush at the Florence SIXO conference, and we've done other things, many other things, but we want to still be active in this field, and we want to improve the situation on a world scale and help reduce the incidence of corneal blindness. So the main issue being how to manage complications and the prevention of these severe problems. These are my difficulties. These are images taken from my experience, and we must. Everybody should be assisted along the learning curve, and this can certainly encourage surgeons a shift to the lamellar procedure. What is SIXO planning to do? Number one, improve the opportunity to establish advanced cornea surgical centers and eye banks in countries, and in this board we have a very important person in Italy and in the world, Diego Ponzin. We are all aware of the excellent job he's done in bringing the Veneto Eye Bank to top levels. And then we do have the support of some American eye banks, and we want corneal surgery centers to be upgraded, and we want to find tissues and to supply tissues in a sufficient amount. And how are we planning to go about this? By organizing specific missions. But yesterday, during the board meeting, it has been decided to increase the opportunity to access specialized centers as in the past, but even more than that, in order to improve the conditions, but also to perform a specific mission. So if there is a colleague of ours in a country where lamellar transplants aren't performed yet, support him or her by means of nurses or assistants who may reach the local center and help the lamellar surgery to be initiated or to be established also in that center. And this is the picture we've taken when the board has been set up. So there are a few people missing who will be represented by the person who have elected yesterday as a president of this international board. And the roles will be renewed every 2 years. Let me invite here the new international board president for the international, for the Cornea Transplant Foundation for Developing Countries.
With this special rule, please can have the medal for our first president you can put in your sleeping room. to wake you up and help this mission. Per cortesia, posso avere la medaglia per Ed Owen?